The Presidential Steering Committee on COVID-19 has inaugurated the National COVID-19 Vaccination Campaign to ramp up coverage to at least 50% of the eligible target population by 31st January 2022. Secretary to the Government of the Federation and Chairman of the Committee on COVID-19, Mr. Boss Mustafa, inaugurated the initiative in Abuja. Mustafa said the National COVID-19 Vaccination Campaign was in continuation of the strategic vaccine rollout plan in line with national response. He reminded Nigerians that the vaccine mandate policy had become a global phenomenon and Nigeria was not an exception. He reminded federal government employees of the December 1st, 2021 deadline for all to show evidence of being vaccinated or a PCR negative test result done 72 hours before being allowed into their offices.
The federal government, as part of its duties and commitment to the welfare and safety of Nigerians, spared no effort in accessing vaccines which were deployed in strategic manner so that the impact of the virus on all facets of our national life would be minimized. In addition to vaccines donated to our country, huge resources have been committed to ensuring that, one, our citizens have access to effective and safe vaccines. Two, awareness was adequately created to ensure that the vaccine hesitancy was minimized. Three, strategy was developed to target the vaccination of at least 70% of our eligible population for herd immunity. Four, infrastructure was developed nationwide to support the supply and delivery chain. And five, adequate manpower was recruited and trained to deliver the vaccines. Six, protocols were developed and updated regularly to minimize the risk of internal spread and importation of the virus. Seven, technology was deployed to keep records of the vaccines administered, people vaccinated, and ensure that side effects were adequately monitored. 8, building health infrastructure and human resources to safely bring the process closest to our eligible target population. 9, strict measures were taken to prevent fake vaccines from getting into the system. And lastly, 10, a futuristic measure, preparing traveling Nigerians for the emerging trends which require full vaccination as a precondition for travel to certain destinations. These sites include public health facilities, private health facilities, mobile vaccination posts, and mass vaccination sites such as schools, markets, shopping malls, recreation centers, motor parks, worship houses, and other public places that attract high human traffic. This vaccination is free because government remains conscious of its responsibility to safeguard the health of our people. Remember, no one is protected and safe until we are all protected and safe.
The Minister of Health, Dr. Osage Ehanire, said the country aimed to vaccinate 55 million residents of Nigeria by the end of January 2022, which is 50% of its target population.
We have enough vaccines, and the assurance of flow of high-quality vaccines from many sources to be certain that we can sustain the campaign to meet the deadline that we have set for ourselves if we all cooperate, if vaccine skepticism is overcome. The Ministry of Health plans to maintain that energy and strive for herd immunity, which we have calculated to be by vaccinating at least 70% of our eligible population. But our preference is to exceed that target of 70%, because the lessons we are learning from observing the developments in other countries is that we need to aim higher than 70% to be more assured of protecting the health of most Nigerians. But this ambition can succeed only with mass mobilization and participation of citizens. This is why I call on all our partners in this fight to confront COVID-19, starting with Their Excellencies, the state governors, local government chairmen, traditional and religious leaders, ward development committees, community leaders, and social leaders, the media, and all citizens to take this as a national task and to urge eligible unvaccinated persons to turn up for the vaccination exercise by just walking to a nearby vaccination center. All vaccines are tagged and tracked by Natl to ensure that quality and potency is maintained in the supply chain. No vaccine is allowed to any vaccination center except it is authenticated with safety verification, because we do not compromise on safety and standards.
The Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib, advised states to commence mass vaccination to expedite efforts to achieve the set target.
As we congratulate the Nigerians who have been vaccinated and thus ensured their protection against the severe effects of COVID-19, we are concerned that there are Nigerians who continue to be hesitant, despite the federal government fulfilling its commitment to providing COVID-19 vaccines free of charge to all Nigerians. Field reports, scientific information, and lessons learned from the phase 1 and 2 implementation suggest that we need to ramp up vaccination in order to fast-track Nigeria's social and economic recovery. Mass vaccination is our strategic approach to rapidly increasing the number of fully vaccinated eligible Nigerians. The mass vaccination strategy is an integral part of our overall delivery strategy, which takes COVID-19 vaccination beyond primary healthcare centers. What this means is that in addition to the primary healthcare centers, we are creating additional vaccination sites in hospitals, university health centers and clinics, pharmacy shops, mosques, churches, corporate offices, private health facilities, etc. We believe that wherever you go in this country, you should be able to find a vaccination site close to where you live and work.